Hello and welcome to Sheila Lives Out Loud. My name is Sheila Moniga. I'm glad you're on this channel. Please click subscribe and hit notifications so you never miss an episode. We upload every Monday. It's not been easy given that we're living through a global pandemic, but we do our best. We are back on track to counting down to season 9. So catch up with me next week for more details on that. But following last week's announcement concerning the lockdown in 5 counties across Kenya, it's only relevant that we get an update on what this means and the way forward with our very good doctor friend, Dr. Simon Kigondu. He is the Secretary-General of the Kenyan Medics Association. Daktari, sasa?
I'm fine, Sheila. And a bit of good news on the curfew restrictions, but that does not lower our guard, so to speak. But we are doing well.
Very good. I'm always very happy to catch up with you because it means there are things which are happening. There's some kind of progress. There's some sort of motion. Most times we're really glad for forward progression, but when we regress, it's always cause for alarm and sadness. And coming out of this recent closure, there's celebration across the land. Let's just say it for what it is. But I've got a few questions for you concerning that. And I kick off with, what was the purpose of that first one? Yes, we know hospitals were swamped, but other than reducing the numbers of people in hospitals, what else did last week's closure mean for Kenya?
As you know, measures taken in a so-called pandemic, a pandemic that where the illness itself can cause severe disease and death, are generally meant to restrict that particular outcome. And measures are taken when the rate of infection, or what is called the amount of infection within the community, is high. And these are guided by what you've been hearing as figures of what is called positivity rates, rate of transmission, and those are the ones that guide what measures need to be taken. When the disease burden, therefore, is high, then we do movement restrictions to try to stop the spread of the disease, and also to stop the spread of the disease to the vulnerable populations. So what happened when earlier on last month, the disease burden hit a high and the spread seemed to have been higher than normal, then the counties which were seen to have the highest number of COVID cases were put into some form of restriction. As I repeat, the aim of restrictions is to reduce the transmission, to reduce the number of people with active disease. And once that has been done, then measures are taken to ease the restrictions. Of course, the problem is that it's always a balance between earning a living and preventing disease. But I guess the measure is that it's easier to sort out your earning a living if you are alive than if you are not there. So I think what comes first is prevention of severe disease, especially to the vulnerable, and therefore reducing the possibility of dying. And then we later on try to earn a living. But on the flip side, then we need to look at the long term. We need to ensure that there are social protection measures such that when we are given directives of how to prevent disease transmission, then we are not dying at the same time. So it is similar to the case of the man in the desert where they are fighting for water, or one is told that they are stealing water, yet they are dying of thirst. So we need to have some form of social protection to prevent, so as to enable us to follow guidelines on disease prevention, like movement restrictions.
Okay. Moving away from, that helps us understand why we had the lockdown because of the rates and helping ease the burden, especially for hospitals across the counties affected. But was that the only thing that happened? What about vaccination? Looking back at hospitals now, are they better off now? Was there stocking of equipment, of oxygen? We were reading about the lack of oxygen in many hospitals. How are we doing with those? What about staffing? Did we actually implement other things other than reducing the traffic to the hospitals? Did we leave hospitals better following this lockdown?
Yeah, those are many questions in one, but we'll start with the vaccine. We'll start with the vaccines. And initially, Kenya, under the COVAX mechanism, ordered 1.2 million vaccines. And this a program was given on how to administer these vaccines, and some priority listing was given. Mm-hmm. And I think they have done this substantially well. And there is a forum called Chanjo. Yeah. Chanjo is where you can just click your name if you've had the vaccine, mm-hmm. and if you've had the vaccine, then you can get your see when your next vaccine date will be. Yeah. And this, as a result of the happenings in India, where India, as you know, the AstraZeneca vaccine, yeah. is produced by the Serum Institute of India and imported into Kenya. And now the situation in India is such that they have even sort of stopped the importation to try to cover their populations, which are suffering much. Mm. Then the second dose, so to speak, has been pushed as a result of logistics. And just to throw in something there is that Kenya should look in future to have a manufacturing plant for vaccines, especially such vaccines here, so that we do not enter into that situation where if another country now has the inability to bring the vaccines, then we have that. So the vaccines rollout was there. The second dose is sort of postponed a bit due to stockouts, so to speak. But that's the long-term solution, as I've said. Ideally, what should happen is that we should vaccinate a large chunk of the population when we, for instance, do a close down or a movement restrictions. That would be ideal. It has been done in some countries. If you look at Israel, a lot of the United States of America, they are vaccinated, and they are hoping in the near future they'll be opening up more. And as a country, strategically, that's where we need to look at.
Instead of just locking down to lessen the burden on a hospital, lockdown should be about so much more than that. That yes, you're locking down, but you're also doing other things while you're locked down.
Correct. And the lockdown is actually to strengthen the health systems and to strengthen the population. Strengthening the population is vaccination. Mm-hmm. Strengthening the health system is ensuring that you have hired more personnel to take care of the increase in caseload, mm-hmm. ensuring that you have stocked the hospitals. Mm-hmm. And your other question, oxygen. I think what we really need to ask ourselves as a country is why should we have low oxygen? And maybe we need to go through the processes of oxygen production and supply, and see whether we can increase the number of suppliers of oxygen. I think those are the issues that we actually need to ask ourselves. Move with speed to have oxygen processing plants in all health facilities across the country. Those are futuristic goals that should be put in the budget, and the budget is coming soon, I suppose. So I suppose these should be budget priority items.
Moving away from what the priority items are, I want to revisit vaccination. Last week, we saw the CAS from the health department speak about Kenya's ranking in the world when it comes to testing. And there was a lot of commentary concerning that number and that figure. If you look at where we stand as a nation, is that a genuine and valid number? Or is there some other kind of variable that was taken into consideration to place us at 7th? Because there's a lot of skepticism about that ranking.
Yeah, Kenyans are generally skeptics, but we must give due to those who are due. The Ministry of Health has done very well in terms of preparing plans of how to manage COVID, in terms of ramping up what they can. And they, of course, the number of tests done are not enough. In a pandemic, you're actually supposed to, initially when we started, you're supposed that you get a case and follow up using a tree to who are the contacts, test all of them, and ensure that those who are positive are isolated, those who are not positive but exposed are quarantined. But because testing is dependent on resources, then of course that our testing rate is low, but we are actually testing. So what is reported as a representative of the population. Although strictly speaking, in a pandemic, ideally you're supposed to test all. If you look at the case of, for instance, New Zealand, Australia, if you get 3 COVID positive tests, then like the whole town is locked for about 2 weeks, you see? So that's the ideal. But when the resources are scarce, the personnel are scarce, then you do what you can and actually reporting. So the Ministry of Health team has done well within its resource limitations, and the reports that we are getting are actually the reports that we are getting, and hence the ranking as it speaks. So the ranking is simply taking up the numbers and saying, Kenya has done this number of tests, then there are 7, you see. So the ranking is a good thing, but we are not at our best. So we need to actually prioritize testing. Actually, if you see what we recommended as the Kenya Medical Association in May 2020, is that we should identify the disease, test, and test more. Right. So I think about ranking, we cannot argue about ranking or not. That is dependent on the numbers that are done, but we actually need to continue testing and testing more because this disease keeps coming up. Now, the more important test that now we actually need is this item called variants. They seem to be spreading faster, and they seem to be maybe having more disease, and therefore we would want a true picture of which variants we have. As you know, when India sneezes, Kenya gets a cold. Or is it the other way around?
But it's the world catches a cold, because a lot of vaccines, I mean, India is responsible for so many different vaccines other than just COVID vaccines.
Yeah. Yeah, a lot of drugs, a lot of commodities do come from India. And also, we have a lot of relations with India. We have a lot of common historical links, and therefore the travels to and from India may be quite a lot. And this can lead to spread of sort of COVID-19 and other variants. So the research we actually need is important to see which variants we have. And we are seeing the variants increasing, so to speak. But scientifically, we just need to follow them up.
Now that we've skated into the pool of the variants, we know there was the Brazil, there's the UK one, there's South Africa, and now there's the Indian one. In looking at the vaccines that are in the market now, looking at the shots that quite a few Kenyans have already had, how are those vaccines testing against all these new variants? And what does this mean for all of us going forward? Does it mean in December, we've got to start Chanjo all afresh because whatever we got was only relevant to this year, and because of these new mutations, then now we've got to start from square one again? What does it mean?
Actually, we don't know. So the way of doing it is actually to follow up the program that we started. If you were to get the, for instance, Covishield, then you continue getting. And if we notice that those who have gotten the vaccines that we have given are getting ill, so to speak, and maybe dying, then we can say, maybe this vaccine is not working against the mutant. But so far, what we have seen, and from talking to physicians who have actually been vaccinated and who have been seeing a lot of COVID patients. We have especially the physicians who see a lot of COVID patients, and they seem, so to speak, to be protected. Then it seems that the vaccines are seem to be working. So I think it's only a matter of time. You can only tell that. Just the way we say that in May 2020, we really do not know what the future holds in COVID-19. But now we have some continuous scientific evidence following collection of data. So speculation on the inability of vaccination to defend against variants is still that. It's still speculation. But the aim is to continue giving. And if you get evidence that maybe you need another type of vaccines, then that can come in future. But in the meantime, you take what is there and follow up scientifically.
Okay, we're just about to close, but I think to myself, in just a few days, schools are going to be open. We're going to have mass exodus once again, where children are going to be back in schools, whether they're going back to boarding schools or day schools. This will certainly have an impact again on our current situation. But is there hope? Are we going to be better behaved? Are our hospitals ready for another wave? Where do we stand now with schools opening soon?
Yeah, so with any form of opening up, then we expect another wave. That's for sure, because the issues that lead to the spread of COVID, for instance, include movement. And when you have movement that has been opened up, then you expect an increase. You expect those who are not sick to spread to those who may be more susceptible because they are not sick, so they interact more. So the aim remains the same. You want to restore to a near normalcy life, but you want to take precaution. And therefore, that's why we say during periods of movement restrictions and so-called lockdowns, although they are not lockdowns, every aspect must be in a preparation mode. For instance, schools should continue preparing to have more water points, should continue to prepare ability to provide masks, for instance, for children who are coming to school, ability to identify, isolate, and treat those who actually get infected. And everyone should start preparing. And for us in the health sector, the association recommends that we have strengthening of the health systems by employment of more health workers, increase in, for instance, critical care units, like now we should have had more intensive care units set up while we are waiting for them, because these the waves will be there forever. But it also serves as an opportunity to strengthen our health systems. So sometimes we may look at it as a curse in quotes, but sometimes it is an awakening. It is an awakening to see that our health systems are weak and we need to strengthen them. But most important for me, I think it's an opportunity to provide financial risk protection for our people. We should go to the national health, NHS style kind of health system, whereby everyone has some form of insurance, so to speak, so that when you get well, you can enter into facilities. Therefore, we need that form of protection. And therefore, as an association, we continue guiding the government on how to protect our populations. But the way to go, we think, is some form of an NHS-like system, and everyone sort of gets some form of financial protection. Because what is your biggest fear? Your biggest fear is that your caregiver will get sick, and all of you will go into financial hardship, so to speak, as a result of a disease that can be prevented and taken care of early. So I think that is the message. And of course, the main message is wear your mask, do the usual social distancing, wash your hands with soap and water. And if you get unwell, do not treat yourself at home. Ask a physician or to assist you and follow their guidelines.
Great. Thank you so much, Daktari. Final question. Are we ready? Are we ready to open up? Are we ready in our hospitals for the wave that will surely come? In your opinion, yes or no?
That is dependent. So there are various people at various stages of readiness. So I think it's individual. So everyone needs to assess themselves and see and ensure they are ready. Actually, put some soap and water outside, have enough masks, and we will continue reporting on the gaps that are there in the health system. Yeah.
Fantastic. Daktari, thank you for making the time to speak with me. I'm always very grateful. And it looks like we both got the memo for red shirts.
Yeah.
This is just hilarious. But again, to echo what you said, let's all follow the protocols. Another wave shall surely be in the offing because of, the opening up, but it doesn't have to be a difficult wave. It can be manageable if we play our part, if we take into considerations and actually enforce those protocols on personal, individual, family, community levels, like scale it up step by step. The higher up the ladder we go, and we should be able to get through this season. Asante sana, Daktari. I wish you all the very best. I look forward to catching up with you again soon.
Thank you very much. We're looking forward to the Monday show, and we will click subscribe. And what is the other part?
And hit notifications. So yes, tell them what to do. Click subscribe.
Click subscribe at the bottom. Is it right or left?
Yeah, it's right there. So Bonella, press it. In fact, points.
Hit notifications.
Right. So you never miss an episode, and we do our best to share episodes with you every Monday. Please drop us a comment in the comment section below and share this video to create more awareness and to help all of us skate through the next couple of weeks. Until next week, Monday, stay safe and live out loud in all that you do. Bye for now.